All right, so I'm gonna do a quick introduction, and I'll leave it to you guys. So on the left, we have Paul, who is our Director of Business and Marketing. We have Nikki in the middle, who is our Director of Simulation. And then we have Andre on the right, who is one of our simulation operators. And one thing I will say already before I hand it over to them is this field of healthcare simulation, it's creating new jobs with people that are not trained. So we have, like, Andre has created a career for himself as a simulation operator, and he has, and what we find is he's a, I see a finger. Are you giving me a finger?
No.
All right, that's Gene, who's doing the camera.
Wait. I wanted to get in.
You're in the picture. Sorry, Gene.
That's okay.
And we have a lot of technology in the building. But Andre has created a sort of a niche for himself because there isn't a certificate or a degree in healthcare simulation operation, right? So he sort of pieced together things, just kind of learning on the job. Recently got a certificate, right, in simulation operation through the Society for Simulation in Healthcare, and really, creating a field for himself. But we look for people to apply, and people just aren't qualified because there's this gap that's been created in this area. So with that, Paul, are you gonna lead it? Go ahead.
Yep. So thank you for the introduction. I wanted to just take a moment to kind of introduce you into one of our what we call exam rooms, and we're going to talk today a little bit about the different kinds of simulation we do here at CAMLS, which will be on both the third and the first floor. And we're going to look at first a high-tech piece of simulation equipment, and then we're going to look at a lower-tech piece of simulation equipment and kind of tie it together before we go and see a simulation. So I'm going to turn it over to my colleagues, Andre and to Nikki.
Hello, everybody.
Hello.
What I'd like to demonstrate to you would be the anatomize table that we use for a lot of different programs that we hold here at CAMLS. One of the good things that we use tables for is for lectures, especially when you're learning about the anatomy. This table is a wonderful tool to use. It's very interactive. Most of your students will be able to pick up the functionality of the table as they use the table. So right now, what I'm going to do is I'm going to take my patient here, and I'm going to cut them in half here. And now what you see is the whole inside of our patient. And one thing that we can do, if you're teaching about specific different types of systems within the anatomy or the body, we can also take away those systems. So now we have our muscle. Now we're going to our skeletal. And I'm gonna bring our man fully back so you guys can see. Okay. And as you see, as I move the slider to the right or to your left, you notice that multiple systems are being removed. Another good feature that you can have for your students would be that you can create a quiz or a game. That way they can learn and identify the different structures of the body as well. So as you can see the quiz mode, and then we could also select, let's say game. Let's make it fun for our students. Okay, and I'm gonna do that one. I'm gonna hit go. And we could select how many players you would like to have. Okay. And once you select your amount of players and you hit start, now you have kind of a who hits the button first type situation. Okay. Another good key feature of the table is that we can take live DICOM files, which would be your X-rays, your MRIs, and we could import it into the table. And what you would get would be a similar patient that you see on the table with the ability to dissect and see what's under different layers of the anatomy or the procedure that you're working on. You can see what's in that way. Okay. Good thing about pointing out different structures of the body, one way that you can do it is you can select one, and what it will do is it will take away the different structures. Okay, so if I took away a rib, or we can highlight the structure. Okay, so if I want to show the brain or the frontal, then it will highlight the frontal. Okay. And now what you're seeing is kind of like a little animation of the way the blood is flowing as I click that button, that dissection tool.
So Andre, what are some of the ways that this has been used recently?
Okay, so one way that it's been used for lectures. We've also used it for different high schools that have come to practice for an exam, and they wanted to use a table with the instruction of one of our faculty members, and they were able to use the table as like a quiz or a practice review. And it's part of their STEM program as well. Another way that we've used this table would be as a skill station, where the students would gather around and they would discuss the different parts of the anatomy that affects their area or the specialty of learning. Okay.
And it really brings to life what they're learning in the textbooks, or better than a textbook.
Yes,
correct?
yes, very, very engaging. Pretty much the textbooks is inside of the PC here.
That's great. So this is one of our high-tech examples, what we would have here for visual learning, as well as for pulling out different types, as Andre said, systems, or talking about types of conditions that the young medical student or nursing student or whoever may need to be aware of, and how they maybe approach something. Let's go next door and look at maybe a less high-tech piece of equipment and how they use that as well.
Okay.
So we're gonna go out this way.
So what they've been starting to do in medical schools, when I went to medical schools, we had 20 stations, donated bodies, we had to dissect everything. Most medical schools are moving away from that. Now they do hybrids where they have things that are already partially dissected, you go identify it, and they do a lot of this, virtual reality anatomy with some models and other things. So it's just
So what is this that you're looking at, Andre? What is this called?
This here is what you call the fundamentals of laparoscopic surgery training box. Okay.
So this is the otherwise known as the FLS box. So Paul talked about it being a low task, but the interesting thing is you can use a very basic piece of equipment to provide high-level training. And to be more specific, or residents who are becoming surgeons have to actually sit a national exam called the Fundamentals of Laparoscopic Surgery. And upon passing that exam, which is a component of 5 different tasks that they have to do within a certain period of time, then they can now go into the hospital and actually do surgery. That has expanded because of the outcomes over all the years that have been collected through the American College of Surgery. There's now a requirement that the OBGYN residents who are going into practice are now required to go through and be certified with FLS by 2020. So even though it's not as high tech as the anatomage table, it still can be integrated into the curriculum to provide the objectives that need to be met as far as proficiency and their competence in being able to provide the procedures that they would actually be doing on a real patient. So basically, this actually simulates the abdominal area of the patient in essence, and with the actual procedure of going in using your trocars. So they actually make holes in the abdomen. For example, they anchor trocars, and then they actually go in with their laparoscopic procedure in a closed environment versus where you would actually open up the patient, belly straight down the middle. You're actually going through holes to make it less recovery time, better outcomes with patient recovery. And with the practice of doing this over and over, more competent physicians that are actually doing these procedures.
So this is a hand-eye coordination exam. So in my layman terms, is not a person of medicine on business development. This reminds me of the Mr. Miyagi.
Oh, there you go.
The wax on, the wax off kind of thing.
Absolutely.
So persistence, 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 and you get it down.
Yeah.
So what else besides moving these pieces over would you do with this?
So we have, this is called a peg transfer that's actually being done currently. We also have a gauze that they actually have to cut the circle around the inner circle. They have to cut without going inside of that first circle. There's also suturing that they have to do. We call it intracorporeal and extracorporeal suturing, which is what they'd actually be doing inside of an actual patient. And then there's also one other task called the endoloop, where they actually have to tighten a knot around a vessel, and it's within how close they are to that one line that's marcated. Then once we actually have all of those scores with what they've done, we have it documented on a form that's actually sent in with the gauze, with the suture vessels that they've done out to San Diego, where it's scored by the national group called SAGES, which is the Society for Abdominal and Gastroenterology Surgery.
So this is not a 1 week thing, this is a multiple months.
Multiple, so they typically practice and then they actually set a date for their test. So there's the cognitive that they do on the computer, and then there's a psychomotor that they actually do here at the box with a proctor. So a proctor has to be certified and recognized with the society in order to test that student, and then they're the ones who sign the certificate of completion.
Okay. And
So,
go ahead.
So I have 2 twin girls that are 13 and they're in 8th grade, and I'm sort of torn because they like to play video games, and we all say stop playing video games, you need to focus, you be outdoors more. But if you really look at something like this from a psychomotor skills standpoint, it's the younger gamers that are amazing at this, and the old school folks are trying to catch up, and they never learn the psychomotor skills. So it's very difficult for some of them to train to this newer, it's not even that new anymore, but sort of this newer technique. It's really interesting how, as we advance in technology, some of these skills, or a lot of these skills that they're learning, the screen time, et cetera, are going to be very helpful for them moving forward. Paul, back to you.
Yes, great, thank you. So Nikki, while we head to our next simulation, why don't you give us a little tour around the floor here, what we're doing, what we're seeing. You guys want to follow?
They're on the 3rd floor of CAMLS, which is a 90,000 square foot simulation center. It takes up about a city block in downtown Tampa.
All right, so this is one of the rooms that we utilize for simulation activities on a daily basis here at the center. And this is an exam room, which typically represents a physician's office. So typically, with our standardized patients who are trained actors, they present at the physician's office with certain diagnoses that the learners either have to follow up, it's been previously identified in the patient's record, or they actually have to do a differential diagnosis where the patient shows up, they have symptoms, they have complaints, but they're not sure what's going on, and that's the job of the medical students or the residents or an interprofessional group of providers with your pharmacists and your nurses who are having to figure out what's really going on with the patient in order to diagnose and actually treat the activity that's happening. So that's a lot of what we do with our OSCE activities that we do here at the center. The student has to document on our system, they're recorded. We also provide that video playback for faculty in order to score, because it is part of their curriculum activity that they do throughout the year. And it is a graded part of their experience as they go through medical school.
No care is given. It's all simulation. There's no healthcare in this building.
So there's about 6 of these rooms where we can actually run the activities pretty much 8 hours a day, every day of the week, if that's what the curriculum requires for that activity. One of the things that we do here in the center, after almost all the activities that we do, is something that we call debriefing. And that's where we have a conversation that's actually led, that's actually led or facilitated by the faculty that's running the program, but it's really set up for the learner to talk about their perception of the experience, what they thought went well, which is called the plus delta, what they thought, not that they messed up on necessarily, but what they thought would be an opportunity for improvement in their practice as students, so that when they're ready to go out into the field and into the hospital, they're able to acclimate and lean back to what was discussed in order for them to feel as though they're learning, with the different interactions that happen in the scenario. And at that time of debrief is when we typically play back that video that we record with the activity, because that's a very powerful tool for an adult learner, especially to learn from when they actually see what they're doing on video.
So like as Dr. Bradner said earlier, we in healthcare training, we're no longer in the stage of the model. It's facilitated learning, and they watch the video, self-reflection, talking from a social learning environment, and the debriefing piece after the simulation is the most important part of the simulation.
And when we talk about simulation, there's a lot of different activities that take place. When I talked about the cognitive portion of FLS, this is actually where the residents come and sit down and they log into the national database in order to take their cognitive portion of their exam, which they have to pass with at least an 80%. Then they actually do the hands-on activity at the FLS box that we talk about. But a lot of these individual tasks are put together in what we call group scenarios and team scenarios. So I talked about the differential diagnosis in the exam room that the learners have to do. Well, we're gonna pop into a room where they're actually running a full high fidelity scenario with one of our physicians who's a cardiologist. And the case is where the 60-year-old patient presents and the learners have to ask the right questions, collecting the history. They have to order the right diagnostic procedures and testing that will enable them to come up with the issue of what the patient is having, other than just where the patient had presented with difficulty breathing. So this is where the patient has pulmonary edema, and basically in layman's term, that's like swollen areas in the lung. And so they're not able to exchange air very well. And so then they have to come up with the whole idea that the patient, based on their history of CHF, that's what they're going into, which requires like immediate treatment.
So is there anything they should look for when we go in, Nikki?
No, just the interaction. It might be where faculty's giving them the information based on the questions that they're asking, because a lot of times the faculty will play the role of the patient.
Yeah,
Any song you like?
not that I can. But personal studio has. What else? You kind of social.
Do you have family history?
Family history, I was adopted, so I have no idea. Alcohol use, I used to drink a 6-pack a day, cut down a year ago to 2 6-packs a week. No drugs.
You have a spouse? Spouse, married? Yeah.
Occupation?
I was
You exercise?
I try to walk when I'm getting fast food. I think that's good.
So they changed, right? He's changed what you expect to see from him overall. Right? Here's a guy that came in with gastritis. You give him fluid, advance his diet. You're walking on the same patients. He's telling you something's changed overnight. Shorter breath. This may have happened in the past. He has some risk factors, hypertension, diabetes. So now you got to stop and say, okay, what's going on with this guy? Let's get some objective evidence, and we'll do a physical exam as well. So vital signs, what do you guys want to see from this?
Temperature.
Blood pressure, good.
Sorry.
That's priority. All the remotes.
Got some eager pulmonary fellows in hospitals, so I got a whole bunch of information here. So top tracing, what do you see? Yes, single lead EKG. Is it wide or narrow?
Yeah.
Good. Are there P's preceding it?
Yeah.
Okay.
So we hope that we've given you a good overview of what we call virtual patient care center here at CAMLS has to offer on the 3rd floor. We're ready to take you to the 1st floor where you're going to learn about surgical skills.
Thank you. Bye, Paul. Hey. Can you hear us?
Yeah.
You're a little choppy, but so we're now on the 1st floor of, here, let me pop it into the camera. So we're now on the 1st floor of CAMLS. Again, 90,000 square foot, it's 3 stories. The 1st floor is focused on surgical procedural training. And we have cadavers, that we can do practice on. We have models. Nicole is going to lead, much like Paul did. And then Dr. Lorena, I think, is going to do the demonstration. And Jean's still down there too? How did he fly down there? Let's see something else. All right, Nicole, I'm going to hand it over to you.
Hi, I'm Nicola Nikki. Most of you just met my boss, Dr. Akuda. I'm here in SITC, the Surgical Interventional Training for Animals. Growing up the daughter of 2 educators, I've always known that I wanted to be involved in higher education. When I found CAMLS, this unique blend of higher education and healthcare. So I'm going to introduce you to Dr. Lorena. Dr. Lorena is our medical director at CAMLS.
Nicole, the mic a little off. Like I think whoever's holding the camera might be touching the mic.
Is that better?
Much better. I think the finger was on the mic. Start again, Nicole. Start.
All right, we'll go again. I'm Nicola Nikki. Most of you met my boss, Dr. Akuda. I grew up the daughter of 2 educators, and I've always known that higher education was something I wanted to be involved in. So when I found CAMLS, I realized it was this unique blend of higher education and healthcare, the perfect combination. I'm going to introduce you to Dr. Lorena. Dr. Lorena is our medical director at CAMLS. He's also a trauma and surgical critical care physician, and he's been working with USF for the last 10 years. So I'm going to turn over to Dr. Lorena.
Good morning, Dr. Kuda. Good morning, Orlando. Welcome to CAMLS. Very happy to be here. Let me show you my patient who just got injured. Now, we'll walk over here. He's been in a car crash. He's been injured. He hit his head. You can look gently down here. One pupil is dilated, one is not. He has a bruise, and he's not really breathing correctly. So we're going to use some technology to save his life.
So, Dr. Lorena, we're in SITC. What is SITC?
The Surgical and Interventional Training Center. It's where you took the practical end. It's the first floor of CAMLS, and it's really the operations rooms of CAMLS. So I'm going to come in down here. When you go down, you can then see with the back of everyone's throat, the little uvula. I'm going to reach down. And right there, you can see these white lines are his vocal cords, and that's the entry into his windpipe. So for this individual who's had a head injury and is not breathing well, this would show me how to put the tube in and record how I'm doing.
So how does SITC help with healthcare simulation?
That's a great question. So if you just look now at our mannequin, now he does actually come with legs, but you can tell right away that my feedback wasn't only that I did this, but that in fact, I touched the teeth a little hard, and I have a timing to see how long, and also his vitals while he was being intubated. If you look over here, you can see his breathing mechanism is working, and I can tell in real time what's happening to the patient. So this provides what's called an immersive learning environment. I believe that this person's in need, and I can help them. And that's what gets it better. But we also have over 30 operating beds as well as a trauma OR. So it shows the other side, the operational, maybe what you would consider mostly in a surgery or procedural base. So let's walk over to one of those stations.
So, Dr. Lorena, everything that we're seeing here today is exactly how it would be in a surgical setup?
This is everything I did last night in operating.
Wow.
So,
very cool.
Large space, wonderful equipment. So this is a typical operating station. It has all the equipment I would have, and I would have doing any thoracic, neuro, or abdominal cases. I have full radiology to work with. And then as a learner, I can practice my skills, get feedback, and know that this is what I can apply directly to where I'm going. The benefit is also the people. So it's wonderful to learn, but it's the people that are here to teach, but also the people that maintain the technology, so we know how the lights work, how radiology works. And that's a greater picture of the team. Because it's not just one person with a scalpel working, it's the whole team getting all the equipment, all the vitals to make sure this patient gets the best chance to survive their injury.
Well, thank you, Dr. Lorena. Thank you for your time. We're going to actually go over and see Health Trust is one of our educational partners at CAMLS.
Thank you, guys. So that was our, as Dr. Lorena said, so those mannequins.
Where are you not? What way are you not feeling great? Any
My back's just tingling a little bit, but that's it.
Getting some IV fluids in you, just to make you feel better, and getting a culture to find out if you might have pneumonia or anything. Oh, it's gone up, eh? All right, well, we can get some Tylenol, 615 milligrams. 250, they putting an IV in?
Okay, Drew, I'll be back.
Okay.
So we're here with Emily. Emily is at CAMLS as part of our STAR RN program. Emily, can you tell me a little bit more about Health Trust?
Oh, well, Health Trust has the STAR RN program. We're an onboard training program for brand new graduate nurses. We transition them through a 5 to 6 week program here at CAMLS facility that helps them feel a lot more comfortable and confident as they start on the floor.
So how do you think that their experience at CAMLS betters the patient outcome?
I think that with the hands-on simulation training and skill stations that we have at CAMLS really helps their confidence and skills, sense of urgency, critical thinking. It's really good in their outcomes coming through CAMLS.
Who are the majority of your learners?
They are all brand new, so they've just graduated nursing school. Most of them have never been in the hospital setting, so just to get this hands-on experience is very vital for them.
Thank you, Emily. We'll let you go back to your simulation.
Okay, thank you.
All right. Well, thank you for coming for a little tour of SITC. Hopefully you'll get a chance to come to CAMLS some point in the future. And I will see you tomorrow, Dr. Akuda.
Thanks, Nicole. I think that's it. All right.